Welcome to the AT&T teleconferencing service. Enter your access code or meeting number. Enter your attendee ID number, followed. Your line has been muted. Press *6 to unmute your own line.
Good morning, everybody.
Good morning.
Good morning. Hi there. Okay, before we jump in, let me just make some comments. Obviously, I think we're facing the biggest story of the COVID crisis and the election all in one, and it comes together as the single biggest moment of the year. I want to thank everybody who has pitched in already and been there for our outstanding coverage, especially and particularly to the CNN Tonight, Don Lemon team, led by Maria and Flip, who were on from 10 p.m. till 3 a.m. with a slight 5-minute gap because of a fire alarm at Hudson Yards at 1 a.m. But did a terrific job, and to Sanjay and Caitlin Collins, who was on all day and all night, Brian Stelter, and everybody who contributed to that coverage, and then to Anderson Cooper and the CNN International team that helmed the coverage from 3 a.m. to 6 a.m. We looked terrific. So thank you to everybody on that front. But I do believe this is the single biggest moment of the year, bringing the COVID story and the election story together. I'll turn it over to Antoine in one moment, but I do think that the big step back storylines within this are the health story and everything that flows from the health of the president and how long he's been sick, whether he was the one who gave it to Hope Hicks or vice versa, and in particular the timeline of his movements this week and what the difference is between quarantine and isolation. So the entire health story, the continuity of government story, and how Congress will react, how the West Wing's going to operate. Frankly, I think we need to be very careful not to put anybody into graves or anything like that, and to be very respectful, but to talk about, the fact that Trump is obviously at much higher risk because of his age and his weight. But the recklessness of this is what happens when you intentionally and irresponsibly flout the advice of your own public health and infectious disease experts by not only not modeling but expressly not encouraging what they encourage. The lack of transparency out of this White House, the fact that why did they continue to travel when they knew there had been an exposure, why they didn't alert the public, but it had to be reported. And then what this does to the election, what this does to the Biden side, what this does to the debates, the political piece of this, and then the national security piece, and how our allies and adversaries are responding. Health, continuity of government, the recklessness, the transparency, the election, and national security. I think those are the 6 big storylines here. With that in mind, I'm going to turn it over to Antoine in Washington, and then I'll turn it over to David Chalian for the politics of it, and then we'll open it up. Antoine?
Thanks, Jeff. LipTac reports a senior administration official says this morning Trump isn't showing major symptoms and plans to work from the White House residence. As you noted, stunning news and lots of questions about country's leadership and continuity of government. Of course, this president who has consistently downplayed the pandemic. So we're going to unpack all of this. Of course, it starts with Hope Hicks and her exposure to the president and exposure to the rest of the cabinet, and of course, the president's health concerns. The president continued to do events yesterday, even though they knew Hicks had tested positive. So we've got Collins and Acosta at the White House look at every facet about the major questions and the most senior levels of government and who might have been infected at the White House. And on the road, we are checking every cabinet member and their COVID status. We are also closely tracking the vice president. His spokesman said this morning he tested negative. Kate Bennett looks at FLOTUS and the support staff at the White House and at how they are being affected. And our Hill team tracks congressional leadership and their exposure. That includes House Speaker Nancy Pelosi, third in line for the presidency. She interacted with Mnuchin and White House officials this week. At the Trump campaign, you've got Ryan Nobles looking at the future of rallies and debates now that the president is holed up at the White House. Chris Christie said this morning no one was wearing masks at debate preps. Will we hear from the president today? He has only one event on his schedule, a phone call about providing COVID support to vulnerable seniors. That's at 12:15, but for now, that is closed press. As you noted on Biden, David will have more about the politics. And what about Amy Coney Barrett and her exposure to the president and West Wing officials? Mattingly and DeVoe will look at that, noting that Manu is with Lindsey Graham in South Carolina as he politics down there. Barbara and Alex Marquardt will look at continuity of government. Evan and Jessica at the U.S. Secret Service and their potential exposure and what it looks like now in terms of protecting the president. Pete Muntean looks at Air Force One and the airflow on the plane. Hicks infected, flying on that plane. Reporters acknowledging they were not told about all of that. And Donnie and Brian will look into conspiracy and anything unusual around all of this. Foreman looks at contact tracing and how that works. That's really my top lines for now, Jeff.
Okay. Then let's turn it over to David Chalian for the politics, please.
So let me just share the latest reporting from Sarah Muha, our embed on the Biden campaign, that is just reporting now from a senior campaign official that there was no contact from the Trump campaign or the White House to alert the Biden campaign of possible exposure. This is from the senior campaign official who was with Biden at the debate. This official added they don't believe they have much risk because, quote, we were never near them, end quote. So that just went out. You saw the Biden's tweet going out with their thoughts and prayers for the president and the first lady. And there was just an internal note sent out at the Biden campaign from the campaign manager, Jen O'Malley-Dillon, that Jeff Zeleny obtained, referring to the overnight news and telling the campaign staff that they're taking every precaution to protect Vice President Biden, Senator Harris, their spouses, and the entire staff, and asking people on the campaign to refrain from posting on social media about it. We are awaiting word as to whether or not Joe Biden's planned travel to Michigan today continues. You saw Jamie Gengel's earlier reporting today that Joe Biden is expected to be tested this morning in light of the news from last night. We know he had been getting tested somewhat regularly since he started traveling traveling around the time of the Democratic convention and forward. But in light of the news, Jamie reported he's expected to be tested this morning, so we await the results from that. We will, as soon as we know anything about the travel to Michigan, we'll make sure to get that out. Obviously, beyond Biden's schedule today, there is the question that hangs over this campaign in terms of the debates going forward. The Commission on Presidential Debates, Frank Fahrenkopf, the head of the commission, is not commenting yet. They are clearly discussing their options, but has no comment to say either about future debates, including the vice presidential debate next week, and obviously the presidential debate scheduled for October 15th would be inside this 14-day quarantine period in terms of the president. But we have nothing from them yet. We also have asked for and not gotten anything from the commission yet about more specifics about every precaution taken in Cleveland, and if there was ever a moment at any time that Biden and Trump were closer than we saw them on television, that kind of a thing. We're waiting word from them on that as well. Obviously, Jeff, just the sort of broad question about how the campaign moves forward. I think much of that will depend on the health information about the president and how sick he is. But clearly, the Biden campaign right now is scrambling a bit to figure out how do you proceed. Can you continue to campaign while the president is convalescing over COVID and beyond whatever risk exposure the candidate may have had at the debate itself. Arlette Saenz was up throughout the night and this morning. Jessica Dean and MJ Lee will pick up this afternoon, and if there is travel, Jessica Dean is there in Michigan for that. And I think that is where we start on the campaign side.
Okay, let's open it up for thoughts on Trump and COVID and any aspect of this people would like to bring up.
Hey, Jeff, it's David. I just have a question. Did Trump do like meet and greets and photo ops at Bedminster at the fundraiser? There could be a whole host of people who are really close to him without a mask on.
No, we've got a report out. He did not do that, but there is reporting out on what happened at Bedminster. And we have names of people who were there, but he did not do photos and greets like that. Other thoughts?
Jeff, you were talking about transparency, which John really hammered this morning, and it's so important. I mean, they didn't tell Kayleigh McEnany yesterday morning, and she went out and did that briefing. They didn't reach out to the Biden campaign. I mean, this stuff really needs to be emphasized.
Yep. I think transparency is a big part of this. And credibility.
Jeff, the recklessness, it can be shown so easily, and I think it's worth us showing some of the visuals. The only gatherings in the country where people have been without masks have been Trump events, from the RNC on the lawn, the indoor rallies in Las Vegas and Phoenix, the peace signing on the White House lawn, Saturday's Amy Coney Barrett announcement where the president could have even exposed his own nominee, and where his HHS secretary was not wearing a mask, not to mention the Tulsa rally where the late Herman Cain attended. These visuals tell the whole story of the recklessness. We know the president doesn't want people wearing masks. They don't. They follow his lead, and the visuals show how dangerous it is.
Agree entirely, and just would add that was also Vivian Salama's reporting yesterday about the guidance not to wear masks in the White House. So it's all of the same ilk. Other thoughts?
Yeah, Jeff, it's Liza. Just a question for medical for Ben or Sanjay. How well equipped medically is the White House? In other words, would there ever be an occasion in which he had to be taken to the hospital? Does he have is all the equipment there that you would need were he to get very sick?
Hey, it's Ben. The short answer, it depends on how sick he gets. I mean, the White House obviously has a ton of medical capabilities. Sanjay actually years ago did a whole documentary on this. He is available to talk on this today in terms of what capabilities they do have there. And the slightly longer answer is it just depends on how sick he gets and what his symptoms are and whether they can be treated there or whether he would need to be taken to a hospital. And depending on his how things sort of shake out, that is a definite possibility here.
Got it. Thank you.
Hey, Jeff, I know everyone knows how important this is, but obviously what time they knew Hope Hicks was positive is just really important in this whole timeline. Kayleigh McEnany was mentioned, but even Trump, if he knew before he went to Bedminster that Hope Hicks was positive, according to the CDC guidelines, if you're a close contact of a positive test, you're supposed to immediately quarantine for 14 days. I mean, Ben can tell me exactly what it says, but I believe that's the case. He never should have gone to Bedminster if he knew Hope Hicks was positive, and Kayleigh McEnany obviously shouldn't have been walking out into the briefing room if she knew Hope Hicks was positive, all kinds of things like that. I believe their own guidelines say that if you're a close contact of a positive test, you must immediately quarantine for 14 days.
Yes, you are correct on the 14 days. It would be 14 days after your last known exposure to someone who tested positive. And then there's even an amount of time after that, after your symptoms have sort of resolved. And, Trump is certainly not there yet by any stretch where you would still need to stay away from people and or if he was around anyone else, wear a mask, because as we've been saying from the very beginning, a mask is something that protects others. And so at least for the next 2 weeks, and probably beyond that and possibly well beyond that, we should be looking at and taking a very critical look at who he is around, why he is around them, and if he is wearing a mask.
Yeah, although my point, Ben, is about this end of it, the beginning of it. The fact is, if they knew yesterday at X time that Hope Hicks was positive, anybody who had been in close contact with her should have immediately quarantined according to the CDC guidelines, as opposed to going to a fundraiser or a press briefing or a meeting on Capitol Hill, as Mark Meadows did, for example, right? So I'm just saying that. Go ahead.
Yeah, I was just saying, and not doing that. Not just the president, but other people as well who knew that they were exposed. It is not at all a stretch to call that reckless behavior.
If I can jump in, you mentioned Mark Meadows. The onus is on the chief of staff to communicate this as soon as they know. I think there's going to be increasing spotlight on the chief of staff and his role and how he dealt with this.
Other thoughts?
I mean, just to the point, Jeff, that everyone is talking about here about what Sam was saying, what Michael's saying here, we all live it every day, those of us, that do come into a CNN building of what is required. So beyond the doctors talking about it, I just wonder, so many businesses or schools or entities that are having people operate in the COVID era in some way have all of these not just the protocols to get in, but the notification protocols, all of that. I wonder if it'd be worth having on our air someone sort of talking through what that, because the White House doesn't do any of that basically. So it's like, I just wonder if it would be helpful to hear from some corporate CEO or HR chief or something that is sort of explains all the procedures and processes that are in place in these entities for an instance like this when a positive test occurs and how just nothing like that occurred at the central seat of power and government in America.
Again, I believe this goes back to the point that I was trying to make, that this is what happens when you intentionally and irresponsibly flout the advice of your own public health and infectious disease experts. And I think we have got to be hitting that hard today. Other thoughts? All right, I'd actually like to just run through and make sure that television and digital is focused on health, Trump's health, the risk factors because of his age and weight, what are his symptoms, and how he is being treated. The timeline of his movements this week, that they knew that Hope Hicks was positive on Wednesday night. It's just, and then they went to Bedminster anyway. The timeline is critical. Pence has tested negative, but that does not mean that he hasn't been infected. All all of the web of contacts, from the folks in the Oval Office to the debate preppers to the donors and fundraisers at Bedminster to Mnuchin, Meadows, Congress, Amy Coney Barrett, all of them. What is Trump doing? Is he in quarantine? Is he in isolation? What's the difference? How is he being treated? And I think it's fair to say that this is the greatest presidential health risk since Ronald Reagan was shot. And I think framing it that way is important. To Liza's point about what's the medical capability within the White House itself, that is the health angle. And I want to make sure we're hitting the health angle. The continuity of government angle, what's happening to Nancy Pelosi? Is she going to isolate? And a reminder that Congress still does not have a testing system. How is the West Wing itself going to operate? The recklessness that Sam Feist brought up. Why did they continue to travel when they knew there had been an exposure? So many in jeopardy because of the president's behavior. And again, to my point about, intentionally and irresponsibly flouting the guidelines of the CDC and the advice of his public health and infectious disease experts. This is come back to haunt them, and this is what everybody's worst nightmare was. Transparency and credibility. The White House did not let anybody know this was broken by Bloomberg and then matched by CNN. The Trump family refusing the debate doctor's request to wear masks at the debate. The White House does not have credibility, and that's a problem now. Just last night, Trump said in his tape remarks at the Al Smith dinner that the virus was coming to an end. Will this have any impact on Trump's mindset on the virus? Is there any chance that this could serve as a wake-up call for Americans who follow Trump and haven't taken it seriously? What was the whole blaming Hope Hicks's infection on military and law enforcement prior to his own positive test? What was that about? Then to the election that David Chalian talked about, and this throwing the entire race into chaos 30 days before Election Day. What will Joe Biden do? He will be tested this morning. What happens politically to Trump losing at least 2 weeks of campaigning? What happens to the debates? And then national security. Does the military do anything? What happens to the markets? And how did Bolsonaro and Boris Johnson and other world leaders handle their COVID diagnoses? Again, health, continuity of government, recklessness, transparency, credibility, the election, and national security. I think these are the broad topics that I want to make sure we're on. And let's not suggest that anybody is going to die or anything like that, but let's make sure we're pointing out the hypocrisy and the irresponsibility that has led to this moment. Is there anything else in Washington?
Maybe too little, too late, but President told Hannity last night he was condemning the KKK and white supremacists, but that's it for me.
Okay. Anything else in politics?
Jeff, I just wanted to raise one thing that we talked about in the digital call today, which is I think we need to be ready for the president to use this as a way to say the coronavirus isn't a big deal. Like him saying, I survived it, I did fine, it was just a little flu, it's no big deal. I think we should be ready for that narrative to hit.
Yep, I agree.
That narrative was already on Fox and Friends toward the back end this morning, talking about how it's going to be easy for him to fight it, and he'll show that it's no big deal. They were already discussing that. And the one other thing I think that we should sort of pay attention to today is what if we don't see him? I mean, if they don't put anything out of him trying to reassure people that he's okay, what does that mean? That they're either hiding something or he doesn't look good or it seems pretty bizarre that they wouldn't try to make some way to present him to the public today.
Yep. And obviously they accused, their opponent of hiding through the entire campaign. So,
and that narrative that it's just that it's no big deal is the narrative that Boris Johnson tried to use at the beginning until he couldn't anymore, and he was in the hospital.
Yeah. And obviously, hold on one second, Rick. And obviously, I'm going to assume that he's not taking hydroxy this time as a therapeutic. But we should report that out. Go ahead, Rick. I'm sorry.
Everybody who was on Marine One with Hope, are they all in quarantine? It seems like in such an enclosed space, all those people who are all bold-faced names, just something I would think we would want to know about because they're central to the continuity of government.
Yeah, and Jared Kushner and Ivanka Trump aren't in the line of continuity of government, but there's no one closer.
I'm in governing. I'm sorry. Not
continuity. There's no one closer to Donald Trump and Hope Hicks than Jared Kushner and Ivanka Trump. But as I just see, they both tested negative in the note that's just come out. So I think that's important to get out. Anybody else? Okay, then let's move to. Sure, go ahead.
Yeah, it's Meredith. Listen, just one other thought. The conspiracy theories and the misinformation are obviously flying around. It's everywhere. It seems even more amplified today, and it's gonna continue into the weekend. And this is obviously, to your transparency point, from an administration that has not been transparent. So that's going to beget more volume on the conspiracy theories. And also worth noting, this is an administration who has embraced conspiracy theories themselves. So it's a real wicked mix out there. It's just getting worse and worse on this with the with all the lies and misinfo and disinfo and theories. And so I think it's super important that we stay tight on what it is that we're going to bat down and how to do that without amplifying it, and what it is that we can do to just be super clear about what is known and what is not known, and what we are being told and what we are not being told, what information is being provided to us and what is not, because I think we want people to come to us for those straight up facts and clarity on what's known and what's not known, and to try to keep the conspiracy theories in a corner.
Yeah.
Jeff?
Just one more thing is for all supervisors, please tell their teams right now to be so careful on amplifying or retweeting anything from social media, just the way we encourage people on the eve of a general election. It's not in anybody's interest to put anything out there that's not been cleared on CNN at a time where this is such an important story with a lot of information, as Meredith said, floating out there. We don't need anybody on our teams to be retweeting something that may get people's attention that we haven't cleared and reported ourselves.
Yeah, somebody else was trying to speak up.
Yeah, Jeff, it's Tim. I listening to everyone talk, I think there's something that we're sort of saying but not saying. I think the ideas we have for coverage are really good. But if you described President Trump, his age, his health, what he was doing, how he was behaving, I think if you describe that to a medical professional who was in tune with COVID, they would tell you, wow, he was trying to get infected. Like this was inevitable. His behavior, right. And I do think
Tim, that's the point I was trying to make. This was inevitable. Yeah. He was playing Russian roulette with what he was doing. And by the way, where's Anthony Fauci and Deborah Birx? What happened to them?
Right.
How's Scott Atlas doing this morning?
Right.
Hey, Jeff.
Yeah.
Jeff, it's Gloria. I have a question about what kind of tests everyone's taking. Are they just taking the kind of quick tests which aren't as accurate as the one that takes a little longer? I think it's called PCR. Then you could help me out with this. But I think sometimes those quick tests are just not worth anything. And so, you have Ivanka and Jared taking their quick test saying they're okay. Do we know what kind of tests everyone is taking? Or can we get that information?
Yeah, White House should be on that. I'm also told that the New York Times is reporting that Ronna Romney has tested positive, so we need to match that as well. So look, my note to everybody is there's a ton. This is just moving very fast. The DLE on digital and our banners on television need to stay up with the latest news and cycle through. There is a ton, and every few minutes, we need to keep doing this. According to Maggie Haberman, Ronna McDaniel tested positive for the virus on Wednesday. She has mild symptoms. She was last with Trump last Friday and has been in Michigan since then. So that seems significant too.
And wasn't she on Fox News yesterday?
I believe she was. So
yeah.
If she tested positive on Wednesday, though, there's no way that she should have been on Fox yesterday. So, look, DLE and our banners, reporting, keep it moving. There's so much we need to keep moving. Matthew Hill, the rest of COVID and domestic, please.
Okay, so the backdrop for all of this, of course, is that all of the signs of the upticks are there. The virus is not coming to an end, the dinner video aside. I'll note that half of the states on our map are going in the wrong direction, and among them, every state that Trump visited this week: New Jersey, Ohio, Minnesota, Pennsylvania, all red on our map. New Jersey is actually the highest week-to-week percentage increase at the moment, 64% increase in new daily cases versus last week. Governor Murphy just tweeted that everyone who attended the Bedminster event should take precautions. Overall, 208,000 deaths and 7.3 million cases, almost 900 deaths again just yesterday. And the average of daily cases up at 42,000, up over the last couple of weeks. Hospitalizations ticking up slightly. And we'll see how all this unfolds in terms of the national response in this ongoing House Select Subcommittee hearing with Azar. The hotspot stories. Wisconsin is just exploding, setting every kind of new record, cases and deaths and hospitalizations. We have Adrian Broadus in Janesville, Wisconsin, the Midwest overall, a hot zone. Nebraska reporting its highest day for cases since May, but also Michigan, Minnesota, South Dakota, Indiana, Ohio, all in the red. And New York, of course, is rising fast again. Statewide, up 29% in new cases over last week. New York City's positivity rate is up to 1.6%. Imperative for everyone in hot zip codes to get tested, the mayor says. Questions and criticisms about whether schools should reclose. Northeastern states still rising. First time in a very long time that we've had 8 northeastern states in the red on the CNN map. New York, New Jersey, Connecticut, Pennsylvania, Massachusetts, Maryland, Delaware, and Vermont. We've got Nick Valencia available in Atlanta on the various regional lines, Evan McMorris-Santoro on education. The vaccine part of the story remains very big, an all-out offensive to shore up faith in vaccines, which is eroding quickly. The FDA's Hahn delivering that message again to the National Consumer League yesterday, saying the agency won't be, quote, pressured by anybody, and this open letter from Pfizer's CEO, letter to employees, trying to distance the company from politics, saying the amplified political rhetoric is undercutting public confidence. So this is the second leading vaccine candidate company to clarify after the Trump comments. We've got the wrap piece today, Nick Watt for 3, 5, 7, and 9. And then I'll just mention 2 other domestic stories. Obviously, this is now the day that we should get the long-awaited grand jury audio in the Breonna Taylor case. The Attorney General, Cameron, has until noon to give it to court. We believe that the link to the 20 hours of audio will be available in real time. Obviously, the fundamental question here is, How did Cameron frame this to the grand jury? The criticism that it was not about Breonna Taylor's death, the grand juror demanding that release of more information. The sequence of events will likely go like this: up live first with news of the release, then whatever we get from the initial read at the top of Cameron's opening statement, again, how he framed it to the grand jury, and then our listening team will pick apart revelations from the audio as we get them. Of course, it could be a while, and Shimon Prokip has up on this. I'll just also note the fires still really bad in Northern California, tens of thousands of buildings threatened. Josh and Dan split the day out there. And that's it.
Thank you. Does anybody have any thoughts on domestic?
Yeah, Jeff, it's Ben. Just a couple other things to add on coronavirus. In no particular order, I just want to make sure that everyone who's listening right now thinks about this as we continue our coverage throughout the day and tonight. The administration puts out a lot of talking points that they hope that we and others will get sucked into, and I just want to make sure that we are being really careful and strong in pushing back on those. To say that someone was not a threat because they were not symptomatic, that is just not true. We know that a very significant portion of people, somewhere around 40%, who are contagious, do not show symptoms or they are pre-symptomatic, and that you can be contagious before that. And in fact, some people are in fact most contagious before they start showing symptoms. So to say I wasn't worried about so-and-so is a completely invalid argument. Also, we've seen from the White House before with past reporting on President Trump's health. They said he's in great shape during his physical. We know he is not in great shape. So when they say that he is well, you can be quote unquote well and still have minor symptoms that could be indicative of a more important problem. So we should be pushing back on that. Also, a quick note on essential workers. The reason this designation exists from the CDC is for healthcare professionals mostly who need to be at their jobs caring for other people who get sick. While the president and the vice president and others in the administration are technically deemed essential workers by the CDC, I think there's a real question to be raised if they do go out and about on whether that is really necessary. And again, just to double back to the point before about, blaming military folks for the infection, no one was forcing, the president or any of these other people out into these situations, and certainly not into the situation without masks. That is something that we should push back on as well. And lastly, this is just a really good reminder for everybody that testing is not prevention. Testing, leads to knowledge and what you are able to do sort of after the fact, but it does not keep you safe from the virus. It could not even keep the president of the United States safe from the virus. And I just want to make sure that we are mindful of all of those things as we continue today.
Okay, anybody else? International, which will be in simulcast with CNN US from here on, other than Amanpour International.
Yeah, good morning. So that's correct, Jeff, and then we'll put all our muscle into overnight programming. Right now, world reaction has been pouring in from all leaders. President Trump joining this unique club of heads of state with COVID, including Boris Johnson and Bolsonaro. Just to break down our offerings today, Nick Robertson can focus on Boris Johnson. He, as we all know, experienced a more severe case of COVID. Initially, there was a quick uptick in popularity on heels of his diagnosis, probably a short sympathy spike, but it didn't last long once he was back and the UK was seeing these increased spikes. But more notably, the effect of the virus, even today, is still a talker in Westminster. The situation, as described by one journalist, is that physically Boris is around, but it's not the same energizing and bombastic leader MPs thought they'd elected. So it's really looking at that long tail of COVID, which still seems to be dogging him, and Nick Robertson can get into that angle. In Brazil, Shasta can report on Bolsonaro. Obviously, he had a more mild version of the illness. We didn't see a major change in his popularity on heels of the diagnosis, but it did help him underscore all his messaging around COVID. Matt Rivers can also weigh into that coverage. He'll also remind us that there are 3 other Latin American heads of state who had COVID. Broadly speaking, just as we look at that question around whether or not Trump having COVID could alter his stance or messaging around it, it is just worth noting that neither Johnson or Bolsonaro seem to have materially altered their approach to governing during the pandemic because of their personal experience with this disease. So they're all separate leaders in different political environments, but that is a point that we could make. And then just lastly, Matthew Chance has reporting out of Moscow, Putin sending a telegram to Trump wishing him a speedy recovery. The spokesperson also reiterated that Putin plans to get vaccinated with their vaccine ahead of a potential trip. But in general, it's also something that Chance can get into, the stark difference in the leadership and styles of both men during this pandemic. Putin, as an ex-KGB agent, perhaps more paranoid at the best of times, he's been very strict and careful with his movements all around, and who comes into contact with him, taking all precautions, while obviously Trump hasn't. So Matthew can get into all of that, and that's what we can offer the show today.
Thanks. I do think it would be good for digital to do a piece on the world leaders who have had COVID. Obviously, as you said, Boris Johnson and Bolsonaro in Brazil, and also the presidents of Bolivia, Guatemala, and Honduras, and the prime ministers of Armenia and Russia. So I think that's a good story. And
yeah, we're on it. We're on it.
And I know, as obviously we know that Boris Johnson was gravely ill at one point. Okay, business.
Jeff, good morning. As you mentioned earlier, U.S. stock futures were roiled overnight on the news of the president. They were down 400 points. Losses accelerating this morning as the BLS reported a worse than expected monthly jobs report, where the U.S. gained back 661,000 jobs in September, a clear slowdown from the summer, the unemployment rate falling to 7.9%. The nation right now recovering 51% of the jobs. There's still over 10.9 million jobs lost during the pandemic. And now when we talk about the unemployment rate, it is noted that these are jobs not being created, but rather massive job losses that are being recouped. The U.S. still only recovering half of those jobs back. And obviously, as we discussed, with no fiscal stimulus on the horizon, perhaps even after the election, more small and medium-sized businesses will be further closed. Consumer spending likely to fall as well. Quickly to break down, big losses in government employment, down 216,000. Local education, lots of custodians, cooks, bus drivers not on the payrolls because the nation is attending virtually. And obviously, we talked a lot about the service sector. Restaurant and hospitality jobs still way down, and by far the worst hit, down about, they've recovered about 60% from where they were before the pandemic hit. Now, the recovery obviously continues to be unequal. Barely a third of the jobs that are back for African American men and women, compared to 60% for white men and women. And the economy clearly in a deep hole. The rate at which we are digging out is slowing. So this clearly is not the job support that the Trump campaign wanted before the election. We have a host of reporters up on this morning: Christine Romans, Christina Alessi, Julia Chatterley, and Allison Cossack on the markets. And in media, as you mentioned, Brian Stelter all over Trump, downplaying the virus a mere hours before testing positive on Fox News. So he's been up on that as well, and that's where we begin.
Okay. I do think that the economic numbers are something we should not lose sight of. Okay. Before we move to digital, is there anything else anybody wants to bring up?
Paul Garcia, just curious, does any press members advised to quarantine, whether they were at the briefings or whether they traveled with anybody that was directly in contact?
Don't know.
None of ours have been advised to quarantine, and we have not been advised. We have not learned that others traveling on Air Force One have been advised to quarantine. But common sense suggests that people that were traveling that had contact with the president or Hope Hicks should. But no, we have not been notified.
The way that people are going the way that people are going to parse this out is, of course, did someone have sustained close contact? Because did they, were they just with someone for 30 seconds and shake their hand and leave? That's a way for someone to sort of wiggle out of saying that they should be quarantined. But certainly anyone who we know or find out has been in any of these situations for the next 2 weeks, we should be pressing them on why they are out and about and possibly exposing others, particularly, again, if they are not wearing a mask.
Okay. Digital.
Hey, good morning. So really quickly, looking back on yesterday, where we had 29.2 million unique Chrissy Teigen and John Legend's miscarriage was our top story at 2.3 million, followed by Hope Hicks testing positive at 1.3 million unique, which was our second top story before the news about the president and the first lady broke. And then Collinson analysis looking at Trump's latest punt on white supremacy rounded out the top three from yesterday. Others over a million were about the stimulus negotiations, Biden using Inshallah, and some smart reporting. That was a helpful angle to the breaking news overnight from Vivian Salama. Not a good look. White House fight over masks signaled COVID-19 plans running awry. So far today, just to note this breaking news right at like 1 a.m. had 165,000 concurrents across the CNN platforms and 275,000 on Apple News. Just big audience at that time. And we continue to see the huge audience across digital this morning. Our top story, the breaking news right by Kevin Liptak, that Trump's positive test throws the U.S. into fresh upheaval, has over 43,000 concurrents right now, followed by the DLE with 24,000 concurrents. And then Stephen Collinson analysis this morning around how this could affect the race with the headline, Trump's diagnosis throws election into chaos and threatens governing crisis, has so far over 11,000 concurrents and rising. And just to mention, the Melania Trump secretly recorded tape, also over 13,000 concurrents in that one right now, so interest there as well. We're looking into all the threads mentioned on this call, but just to mention that we have out and upcoming a timeline from Liptak on Trump's activities this week. Right from Health, Maggie Fox, Jamie Gumbrecht, and Jen Christensen, looking at the risk factors that are present for the president and the first lady, and a look at what Trump CDC guidelines say should happen next. We're watching the markets today as the diagnosis sent futures sharply down overnight and rattled global markets. And on the media and tech threads on Trump's diagnosis, we have coming analysis. Credibility is critical at a moment like this. Unfortunately, the White House has none left. And as Meredith mentioned, looking at how to handle some of the conspiracy theories on social and how to bat those down without amplifying. And we have out the headline on how Trump downplayed Hope Hicks' COVID diagnosis on Fox hours before announcing that he had also tested positive. We have a global look at Trump's positive coronavirus test, putting him in the company of Boris Johnson and Bolsonaro from Laura Spitz-Spark. These other leaders who had also had a certain disregard for the virus. And also a specific piece looking at a comparison to Putin. Trump kept a busy schedule during the pandemic. Putin stayed in a bubble. Just lastly to mention from opinion, Stan Vinograd writes that the positive coronavirus diagnosis of Trump and the First Lady is a worst case scenario from a national security perspective and maybe the most dangerous moment the federal government has faced. And the headline is this is a code red moment for the U.S. government. And I'll stop there. Thanks.
Right. I think all of Trump's comments, that last night at the Al Smith dinner, that this was essentially over, his comments at the rally last week that this doesn't really impact anybody, all of this now comes back to haunt him and should be exposed. John.
All right, so John Howard and Caitlin Collins taking lead out of the White House, really going to drill down on the timeline of events, keep filling in those gaps, all the questions of transparency. Several have already been raised just in the past half hour involving Kylie McEnany and the Biden campaign. New reporting that they're going to begin the contact tracing operation for those who've been in touch with Trump and Hicks, and also new reporting that they may look for a way for Trump to speak publicly today, getting to the point that was made earlier on this call. Will we see him at some point at all? Obviously, we'll land on that when that happens. Drilling down on just the past few days, we have a number of reporters, both our own and others, who have been traveling with him. Sungmin Kim, SD Date from the Huffington Post, Olurnipa, really want to kind of drill down on just everything for the past couple of days, who was in contact with him, who learned what when. We'll stay on all of that. The Secretary of the HHS, Azar, is testifying right now before a House Select Committee on coronavirus. It was pre-scheduled. I'll wait for the Q&A and see if we learn more about Trump's diagnosis during that. Sanjay Gupta continues to work during the day. We thank him for that. Elizabeth Cohen also on all the medical questions, the high risk factors that Trump has, his overall health, what sort of treatment is he getting. John King has booked a former White House physician, William Lang. We also have Dr. Richard Besser, Leana Wen, and Amesh Aldaja to handle all the other health questions and the dangers of ignoring the health advice. Jessica Dean stays on the Biden campaign angles, waiting for his test results. Is he still traveling to Michigan later on today? Ryan Noble is on the Trump campaign side. David Chalian, Gloria Borger, and Abby Phillip on that. Lauren Fox just got Pelosi, who we also just learned has gotten tested today. So we have that interview going on. Alex Marquardt on the continuity questions, continuity of government questions. Tim Naftali, Mike Rogers, and Carl Bernstein add to that conversation. Christine Romans and Julia Chatterley, the markets reacting and the jobless numbers. Phil Mattingly, also on the Hill, going to stay on the Amy Coney Barrett storyline. Both McConnell and Lindsey Graham say they are still on track with an October 12th beginning for the confirmation hearings. We'll see if that sticks. Barbara Starr on the national security questions, Julia Kayyem and James Clapper on that. Kate Bennett joins us on the First Lady's past health issues as she battles COVID. And finally, international reaction, Nick Robertson, Fred Pleitgen, and Matthew Chance hitting that angle.
Thank you, John. Washington.
Good morning. We'll pick up at 4. Caitlin, of course, laid it all out. Well, we've seen the very latest, and we launched Foreman on contact tracing following the web of possible exposure over the past week. And we'll look at Pence and the continuity of government, at the lack of transparency, and of course how reckless they've been and how cavalier they attitude up to the very last minute. Our guests include Sanjay, Ashish Jha, other medical professionals. We're talking to some lawmakers, and of course we'll heavily leverage our reporters across the entire breadth of the story. Jessica Dean on Biden, certainly the campaign, the debates, and we'll turn to Abby Ron Brownstein among others, and market impact as well.
And in the Situation Room, we'll obviously be following the 6 buckets outlined: health, continuity of government, recklessness, lack of transparency and credibility, impact on the debate, and national security. So we'll be watching developments across all of those threads through the day. We'll watch to see what happens with this 12:45 Trump call, if it opens up, if we see him, will Biden be tested? And see what else we learn about all of these timelines. Our bookings are a work in progress. We are bringing back Bob Woodward and John Bolton. We'll have Sanjay and all of our top doctors, as well as Acosta at the White House, our Biden reporters, and our political and national security analysts. We'll also be getting international reaction from our whips. All of this is half of the country is still trending in the wrong direction. And these surges that we're seeing, particularly in New Jersey after this Bedminster fundraiser, we have Governor Murphy booked there. And I think those are probably the highlights for now.
Okay, great. Anything else anybody wants to bring up about today before we move to the weekend?
Yes, Ben. Go ahead.
Well, this is totally unrelated. Ben, you go ahead, and then I'll shoot it. Okay.
Thanks. I was just going to make one other point really quickly. Again, reminding everyone that the incubation period for this virus is up to 14 days. So anyone who's coming out and saying, I tested negative, I'm fine. If their last exposure to someone who is known to test positive for coronavirus was less than 14 days ago, they cannot medically say that they are fine, they are not a risk. We should be pushing back on that. That was the last point I had to make.
And Ben, what's the guidance on how often they should be tested?
There is no specific guidance on how often people should be tested. I mean, after they've been exposed, again, up to 14 days to incubate. So you should stay quarantined away from other people if you believe you've been exposed, and then you're, in consultation with a person's individual doctor, would make a recommendation on when to be tested. Also, the latest research shows that it does take on average for most people, if they are going to get sick, it takes about 5.6 days or so. So if you're really getting the test before that, it's really not going to be something that gives you any degree of certainty whether or not you've been exposed. So, for example, if I was exposed to someone right now, even for an extended period of time in close quarters, and knew I had been exposed, that test would not come back positive right away. So it is really important to press people on how long they have waited for the test and how confident they are in those results based on how far out they are, not how they are feeling, because that is not indicative of whether or not you contracted this virus.
Yeah, okay.
Ben, can you tell us a little more about if you are, let's say, you just use the example, you are exposed today, if symptoms show up in 5 to 6 days, are you contagious in that window before you start showing symptoms, or do we know for certain?
For certain, we know that you can be, in fact, most contagious before you start showing symptoms. So that's what makes this such an interesting virus. You know, not to make a direct comparison, but if you look at Ebola, for example, Ebola is highly, highly, highly contagious, but you are not contagious until you are very, very obviously sick. This is the exact opposite, and this is what makes this virus and this disease so hard to combat, because people don't take it seriously until and if they are experiencing symptoms. But we know that most people are going to be the most infectious before they develop symptoms, and so that makes it harder, because it is just, you know, truly the invisible enemy, as a lot of people have called it, which makes it even harder to get people to take it seriously.
That timeline, remember this timeline that Ben has just laid out takes you back until the weekend, Saturday, when the president was with Amy Coney Barrett and all of her family, and you saw them all walk out of into the Rose Garden together. Nobody, of course, wearing masks. So that whole period could be an exposure period.
Yeah, and
look,
I think a few other.
Go ahead, Ben.
I'm sorry. I was just saying, I think a few others have made this point as well. You know, just a reminder that we do not know that it was Hope Hicks who infected Trump. It could have been the other way around. It could have been, you know, someone else. And I think this again underscores the complete failure of contact tracing in this country if they are not able to point to, you know, when he was likely exposed. But again, there is no way to know for sure who got it from who. But just remember, just because someone tested positive first doesn't mean they were the first person to get exposed.
Yep.
Jeff, it's Carl. On the continuity of government questions, both going back to last night and going forward, we ought to take a look at actually the nuts and bolts of who is running what and what happened last night. Was there a DEFCON mobilization in which the NSC started coordinating extraordinary things? And who is really going to run and is running the hour-to-hour coordination of the government while and if the president is not altogether in charge of things? And really a nuts and bolts look at who the people are and what the mechanisms are in place.
Yeah, look,
Good question, Carl.
I think what happened last night is really interesting, and I was going to say that the timeline of the last week is a very important story to do.
Yeah.
Somebody else, go ahead.
Hey, yes, Marcus. I was going to take the question, Carl. There's lots of chatter about different planes scrambling last night. I won't go into all of it, but our Pentagon reporters can do nice stuff on it.
Okay, listen, we're going on. I want to move to the weekend quickly and start with Smirtanish.
Hey, good morning, Jeff. So as you said, this is moving so fast. This has changed our show, and we're going to be all over this in the future of the presidential race. We'll be on the TikTok as that continues to develop, how he got this and who he's around. Three most important issues of this campaign: COVID, healthcare, and the economy. And we know markets don't like the uncertainty. We're also going to be in quarantine versus isolation. Now, the CDC recommends you should be isolated for at least 10 days after symptoms onset and until 24 hours after their fever subsides. So how will this play in the next presidential debate? Frank Fahrenkopf has agreed to come on our show once the changes to the debate are announced. We thought that was going to happen this Saturday. We'll see. So he's still saying he'll come on once they announce changes. And the Trump campaign has boasted that it knocks on more than $1 million a week. In contrast, the Biden campaign has ditched that ground game, and it's winning. Trump is winning the voter registration battle. But how does that change this now that Trump has COVID? And of course, we're going to be ready for Republicans to play this and make it. It's no big deal, but it's too soon to do that.
Thank you very much. Thank you very much. Inside Politics.
The big October surprise, Trump's coronavirus diagnosis, working on all angles, including Trump's health, Trump's past pandemic behavior and statements, what the White House is doing, how this is impacting government and the economy and the quarantine campaign. We're still working out all our guests, so we're in a bit of a TBD situation. And that's where we start.
Understood. State of the Union.
Hey there. We are also reevaluating and still booking. Obviously, we'll be focusing on this big news, the health story, the continuity of government, transparency, the impact on the campaign. We are supposed to have the first interview with former Trump campaign advisor Rick Gates. So we'll plan to talk to him about, all of the insight that he might have about the inner workings of the campaign and the characters in the White House as all of this unfolds, and also a little bit about his own situation and, other bookings to come shortly.
GPS.
Thanks, Jeff. We too are rejiggering and rethinking. We'll look at the health, national security angles, and also what can we learn from the other world leaders who have had it.
Reliable sources.
All right, obviously transparency and credibility amongst the president and his media enablers. Brian spoke to Fauci earlier in the week, and Fauci was talking about the importance of knowing the facts. He also took a shot at Fox's role in all this. On conspiracy theories, we have a rare appearance by a Twitter exec, their head of PR or beyond, and then we'll get into whatever's happening with the debates and Chris Wallace's performance.
Does anybody have anything else they want to bring up? Obviously, our schedule will be adjusted to reflect the moment that we're in. I would just reiterate that I think that obviously this is the greatest presidential health risk since Reagan was shot. This is the most significant moment of this year that combines the two biggest stories of the year in COVID and the presidential election. This has clearly thrown the election now 30 some days away into up in the air, with it unclear on how things will proceed and what will happen. Let's make sure we capture the enormity of the moment and make sure we don't lose sight of COVID in the entire country with our wrap pieces and what's going on across the country. This is obviously a story that will have huge ramifications today. Through the weekend. Let's stay newsy. Let's stay urgent. Let's make sure we are vigilant and diligent in all of our banners, all of our reporting, all of our digital rights. Let's get everything right. The world is counting on us. We have been terrific thus far. Let's make sure we meet this moment. Have a great day and a great weekend. Thanks, everybody.